probably the night that I killed a man. Oh, I remember it like it was yesterday. I sat there in the M1A2 Abrams tank, my eyes planted in my binocular sights. I saw the battlefield through shades of green and white, and suddenly, a white hot spot appeared on the horizon. My hands clutched that Cadillac as my hand squeezed the trigger. I had never seen anyone fall like that before. Life instantly evacuated his body. Now, our lives, our minds, and our souls were sacrificed in those days of war. Searching the farm, I found the man that I had shot, his body now dead and lifeless. I don't know what possessed me to look at him, but when our eyes met, whatever I had taken from him, he took a part of me too. That was the seed of the post-traumatic stress. And once we were used to the daily threat of death, we were forced to come home to our families, a quiet, peaceful environment. Fighting PTSD is a daily struggle and can only be likened with death, except we're still breathing. Now, this is just one recount of one soldier's experience with PTSD. Hundreds of thousands of soldiers are going through this daily, day after day, night after night. But little do they know that there is hope for them. And little did they know that when they came home from the war, they were completely leaving it behind. Part of the war came with them too. That war is PTSD. But in order for one to understand the suffering that these veterans go through, one must know what the basics of PTSD are. PTSD, or post-traumatic stress disorder, can occur in anyone after any traumatizing event that threatens life. There are 4 individual categories of trauma that the events can fall into. First, as you've already seen, is war, where soldiers experience combat in Iraq or Afghanistan. There's also terrorism, as you'll see here in this picture, the 9/11 attack. Violence and abuse, including sexual assault, rape, and child abuse, and disasters. There are human-caused and, I lost my train of thought. There are human-caused and natural, as seen here, the earthquake in Haiti that happened a few years ago. Now, how does PTSD develop in one's brain? Well, first, there are several neurological changes that occur in 2 specific brain structures, the amygdala and the prefrontal cortex. As you can see here in this diagram, both structures are located towards the front of the brain, and they deal with emotions and judgment, which both play key roles in the effects of PTSD. Now, the probability of acquiring PTSD depends on numerous factors, depending on the exposure and severity of the event. One's PTSD might be more severe than another's, depending on how strong their reaction was, how close they were to the event, and how much of a relationship they possessed with a person who may have been harmed or even killed. However, the official diagnosis of PTSD occurs after 1 month of symptoms or more. Now, almost all soldiers will develop PTSD when they return from combat. However, if these symptoms continue for a month or more, they need to seek professional help. Now, as we take a look at this chart, you'll see the combat experiences reported by members of the U.S. Army and Marine Corps after deployment to Iraq or Afghanistan. You'll note that some of the most common events that cause PTSD included being attacked or ambushed, seeing dead bodies or human remains, and seeing ill or injured women or children that they were unable to help. You'll notice that these soldiers most likely felt out of control of these events, which may have only worsened their PTSD. Now, what are the symptoms of PTSD? There are 4 specific indications that each soldier should recognize. First, reliving the event. Soldiers may have nightmares or flashbacks in the day and night where they experience the same fear and horror that they did during their traumatic event. Other times, a sound or a sight may trigger their minds back to that event, and they relive the whole experience again. There's also avoiding similar situations, where soldiers may avoid people or places that remind them of the event. Soldiers also experience emotional numbness, where they find it hard to express their feelings to their family members or counselors if they seek help. And lastly, soldiers tend to behave in a hyper-arousal manner, which means they're constantly jittery, may have sudden outbursts of anger, and are always on edge. Now, one must understand that PTSD is not uncommon. It is estimated that 1 in 5 returning soldiers develop PTSD. That's about 300,000 men and women. 17% of that population includes women combat troops. Now, on a side note, PTSD is twice as likely to develop in women as it is in men. Lastly, 23 to 40% diagnosed veterans sought professional help. The other 60% were trapped in their own living nightmare day after day. Now, what is the stigma that may be preventing soldiers from seeking the help that they all deserve? Well, most soldiers believe that as soldiers of the U.S. Army, Marines, Air Force, they're made to be strong. They're warriors. They shouldn't have any flaws or weaknesses. However, this may be the farthest from the truth. Soldiers may fear that their PTSD may harm their military career. They believe that peers or their leaders may look down upon them for having simple mind issues. Also, soldiers may feel embarrassed and ashamed of their problems. Lastly, and most importantly, soldiers fear the disorder label. It misleads them to believe that there is something wrong with them. And again, the stigma that soldiers should be strong and constantly okay. However, this is so incorrect. But for soldiers that do take the right step and deserve treatment, there are 4 main types of treatment that have made leaps and bounds in the century. First, it is cognitive behavioral therapy, or CBT. Constantly recounting their event and the emotions that they experienced during that event helps them to overcome fears or any negative stresses that are associated with that event. There is also animal-assisted therapy, including dogs, cats, horses, which I will get later into in my next slide. There's also eye movement desensitization and reprocessing, or EMDR. Now, this is a more common form of treatment. It was just recently developed about a decade ago. And what it is a doctor may move his finger in front of the patient's eyes, and the patients are instructed to follow the finger movement, excuse me. Now, this is scientifically proven to reduce stress levels while they are recounting their event and their emotions. Lastly, medication can be taken by soldiers, most commonly the same medication that may be used for depression or anxiety, which are both symptoms of PTSD. Now, as I said before, animal-assisted therapy has made great leaps and bounds with helping PTSD. But why horses? Well, first, the responsibility in taking care of a horse distracts a veteran from any stresses of life or PTSD. A simple task as brushing a horse or putting a halter on can relieve their stress and distract their mind from any other thoughts. Horses also force soldiers to overcome any fear or intimidation. I think we all can agree that a horse is a fairly large animal, and some soldiers may be afraid of them. But trying something new and learning to interact with the horse also helps them with their motivation and self-confidence. Horses also reflect veterans' emotions. This is extremely interesting, and speaking from my own personal riding experience, if a soldier stands by a horse, or especially when they ride a horse, the horse is extremely sensitive to the emotions and thoughts that are going on inside the rider. For example, if a soldier was nervous and tense while standing by a horse, the horse would pick up on those emotions, and in return act the same way. The soldier learns in order to calm the horse and make him have the same reaction, he himself needs to calm his own emotions. Horses also respond unconditionally with no expectations. Again, soldiers believe that certain stigma that they must always be strong with no problems. However, horses don't judge you. They don't care if you have PTSD or autism, they're just there. Lastly, horses provide a unique relationship. And this is not just with horses. Dogs and cats, they provide a unique bond between the soldier and the animal, which can help relieve stress and provide a peaceful and calm environment. Now, before I go on to a video, we're going to go over my trifle board and let the scroll in. Common effects that may also be symptoms of PTSD include drug or alcohol addiction, depression, which most commonly leads to suicide, employment complications, which goes back to the stigma that they believe the leaders or peers may look down on them, and difficulties in relationships, such as abuse and violence. Soldiers may suddenly have those angry outbursts that go along with reliving their events, and may often lead to child abuse or abuse of their spouse or children. Now, PTSD is not new. Since the American Civil War, it has been called soldier's heart. In World War I, it was called combat combat fatigue or shell shock. In World War II, it was called gross stress reaction. And most recently, the Vietnam War, it was called the post-Vietnam syndrome. You'll also notice the task that equine-assisted psychotherapy, or EAP, involves. It centers on the veteran-horse interaction, developing that unique bond I earlier mentioned. It involves simple tasks, which may range from brushing the horse to learning how to approach it, or as simple as putting a halter on. This unveils the client's behavior patterns and emotional state. However, it does not usually include riding, but the horse can still receive those emotions that the veteran is experiencing simply by standing by the veteran. Also, the effects of equine-assisted psychotherapy. Soldiers experience reduced depression and anxiety, and they have increased independence and self-confidence. In a recent study by the EAGALA, the Equine-Assisted Growth and Learning Association, they conducted a study with Marine veterans, and they found that 100% of those veterans had greatly reduced stress levels after equine-assisted therapy. Now, there's a program here in Fort Benning that I'm sure some of you may have heard of, the Wounded Warrior Horsemanship Program. This allows soldiers and their families to interact with the horses and connect. I had the opportunity to volunteer there on April 14th, 2012, and talk to some of the other members of the community to gain their insight on PTSD and how horses can help them with those symptoms. So now we're going to watch a quick video about those interviews.